Today I would like to talk about why UK GPs are moving to Australia and New Zealand. If you haven't subscribed, please subscribe down below. I'll be uploading more videos like this. I'm Nura. I'm one of the doctors working in the UK. Did you know that a lot of UK GPs are moving to Australia and New Zealand? Although these numbers has reduced recently because of COVID, there are still a lot of UK GPs, well, not just GPs, a lot of UK doctors moving to Australia and New Zealand. So let's see why. So the first is UK GP salary in comparison to Australian GP salary. Now UK GPs work around 42 hours a week on average and earn about 90,000 a year. It's shown that Australian national annual average for Australian GPs working 39 to 43 hours earns about 210,000. So there's about a lot of difference there. And research has found that average family doctor in the UK are seeing about 205 patients a week. That's a lot of patients. But Australian GP, on the other hand, only see an average about 114 patients a week. That's almost half compared to UK. So they're seeing almost half, but they're earning double or more than the UK GPs. So the stats clearly shows that the GPs in Australia are far better off in salaries and working hours, which allow them to get a better work-life balance. So not surprisingly, that's why Australia is popular destinations for UK GPs. So basically, they found that average UK GPs work about 42 hours a week, 60% works about 50 to 59 hours per week, 28% 40 to 49 hours, and 33% work less than 40 hours a week. And basically, this survey finds that 20% of GPs are actually working 60 hours or more every week. Given the GP shortage and the high pressure, it's just putting a lot of pressure, and that's the reason why GP in the UK tend to move somewhere else. So working hours as UK GP in Australia. So some practices in Australia are open 7 days a week, but they usually open 6 days a week up to 12 hours a day. And typically you can expect to work about 40 hours a week, but depends on what we've negotiated with the employer. Yes, part-time GP work is available in the Australia, but the locations are limited and is only available in certain parts of the Australia, but probably not available in the bigger cities like Melbourne or Sydney. And also, I think the amount of the hours that we work when we move to Australia is kind of fixed, just as the requirement when we first moved to Australia. But the hours can be negotiated with practice before moving. And they've advised that it's best to work pro rate, so working one evening per week and working some weekend days. This will give a bigger base. Third reason is the weather. I mean, have you seen the weather in Australia? It's so beautiful. It's sun every day. Like, people are so happy, so sunny. Compared to UK, it's always raining, dark winter mornings. So no months of drudgery are not seeing sunlight. So if people like outdoors, that's why they found Australia is much better for them. You know, they can cycle to work, which is pleasurable. You're not freezing cold when you're cycling, and you actually can literally go for a run on a beach before going to work. Also, you can have a pool at house. I mean, I don't think a lot of people have pool in the UK, but in Australia, yes, you can have pool, and a lot of them have. The next reason is basically they said that Australians are really relaxed, really friendly, and people actually genuinely want to help you. I mean, this is what been told to me by people who've worked in Australia before. And the holidays, I mean, working Australia, there's a lot of annual leaves, and you can take it almost anytime you want, because I'm talking about GP, but also if you're in the hospital, they have a relief team of doctors whose entire full-time job is to rotate between various departments where the doctors goes on holiday, and then they will replace the doctors during the duration of the leave, which is amazing. Do you know how difficult it is to apply for a leave in UK hospital? Because you have to find your own cover and make sure that there's people covering the ward yourself. Also, doctors in the Australia get a higher study budget, around 4,000 Australian dollars. Compared to UK, we get £650 every 6 months. And actually, if you're sick, the Australian, they tend to ask you to stay at home. They encourage you not to come to work if you're unwell. Unlike in the UK, if you're sick, then probably, most UK doctors tend to persevere and work still even though they are sick, which is a bit different to the culture UK versus Australia. So the healthcare system in Australia is different than the UK. So UK is governed by the NHS, so everybody gets free healthcare, and obviously for people like us, I mean for me, like IMG, we also pay national insurance, which is taken out of the salary. Now healthcare in Australia is more expensive. It's mostly government funded, but it also covered by a part of the private sector as well, and it has a bigger private sector in Australia. So patients can actually choose, and normally they have private insurance and they always choose to go to a private ward in Australia. So, and also the system is great, there's more staff around, easier access to investigations, you know, because in the UK the investigations are governed by our guidelines, and each investigation is actually also limited by cost as well, but not in Australia. And more freely available medication is available in Australia. Making referrals to specialties is much easier in Australia, like not like in UK, where sometimes you feel like a bit more interrogation especially when you're on the phone. So Australia's public healthcare system is Medicare, and it provides accessible and affordable healthcare. It's funded by the general taxation, which includes the Medicare levy. I guess it's kind of like the national insurance, and is managed by both the Australian governments and the state or territory governments. So individuals pay to see their GP, but they are reimbursed all or part of the cost via rebate from Medicare. Now doctors practicing in the private sector, they choose their fee of which they will charge the patient. Normally doctors need the provider number to claim the rebate from Medicare. Now the difficulty of moving to Australia, the cons is the 10-year moratorium. So this is a new, well, not kind of new, but because a lot of doctors are moving to Australia, so the government in Australia has introduced this 10-year moratorium, which means that doctor has to work in the priority area for at least 10 years before allowed to work in the bigger cities. This is because they want to spread out the amount of GPs. Instead of just being concentrated in the bigger cities, they want to ensure that a lot more GPs available in other parts of the Australia as well. So you can reduce that time through scaling. So scaling means that if you work in a certain parts, then you might able to reduce. So I guess it depends on, more difficult to reach parts, then you have to work only 7 years. So kind of like that, they actually explain this in their website. You can only end the 10-year moratorium if we are permanent resident or citizen, but if we are temporary resident, unfortunately the status remains unchanged. The cost of living is also much higher than the UK, so I guess it makes sense that the salary is much higher because the cost of living is also much higher. If you're thinking to move to Australia, then you might think of moving your pension to Australia as well. There are a lot of requirements necessary to successfully move the pension from the UK to Australia, but recent changes to regulations have made it much easier than it used to. The process to move to Australia, so basically is first find a position, so find a job, look for posts advertised. So there's two ways you can do this: either look for the advertisement or go through the agency, and the posts are normally advertised in BMJ or the classified section of the MJA, Medical Journal of Australia. You can also find it on agencies as well. So there's 5 steps to registering to work as a GP in Australia. It normally takes around 6 to 9 months, although I'm not really sure now with COVID, does it take longer? I would presume if we go through by an agency, probably it will be much easier, saves time, and also less headache, I think. And it is done after we've got a job offer. So the first is we need to register with the AMC, so get the documents together, and then we have to send the documents to the AMC, and they will send it to RACGP. They will then check whether you meet the requirement of category 1 AGP. RACGP will ask the letter from RCGP, letter of good standing, and also formal offer from the employer. This is in addition to all the required documents documents. Then we apply to AHPRA, which is the National Health Board that will give us the registration to work as GP. And this can be started while waiting for the RACGP approval, although it won't be finalized until the RACGP has finalized our registration. Next, we have to arrange the visa. So basically, they said that we will need a 457 visa, which is sponsored by the employer, and it can take about 2 to 4 weeks. I would think because of the COVID, it definitely takes longer for this, and normally covers partner and family as well. So once in Australia, then we will have to collect the AHPRA registration from the office using the in-principle letter that we've received earlier, and then arrange the Medicare number because we need to bill the patients using this number. We'll have to visit the practice, sign the forms, and send that off for approval. So it takes a further 2 weeks. So in summary, probably need a lot of money, a lot of time, a lot of preparation to move to Australia. So it's not something to be taken lightly. And I understand that if we work in Australia, because we are kind of self-employed, we are the private employer, then I'm not really sure whether if we're sick or maternity leave, whether that's covered or not. If you would like more information about moving to Australia, then definitely join Facebook groups. There's a few Facebook groups about this topic, and I have joined some of them just so that I can get information. So even though I'm still in training, it is in the back of my mind, so I thought I would just join. There's a lot of agents as well, a lot of opportunities, a lot of GPs there who've currently working in Australia and gone through this process themselves. I found them useful, and hopefully if you're thinking about moving to Australia or New Zealand, then definitely join these support groups, because if you have any question, then you could just post it in there. They will answer all the questions, especially the agent as well. They're very friendly. I've received a phone call myself from agent in New Zealand when I joined one of the support groups. There's constant updates about Australia and New Zealand, about the immigration or about doctors moving there, just because New Zealand has much better, you can work anywhere in New Zealand. They are not governed by this 10-year moratorium. So I might make another video about a UK GP moving to New Zealand in my next video, so check that out. So if you haven't subscribed, then please subscribe down below, and hopefully you found this helpful. I'll put more about my videos about GP training, so if you're interested, then please have a look at that. Okay, see you then. Bye.